We are now 3 years deep into the COVID-19 pandemic that has spread worldwide. Society has since adjusted to living in an active pandemic, but one environment that has been severely impacted is hospitals and medical care facilities. Good afternoon, I'm Asia Anderson. I'm here with Amy Rodriguez, a licensed nurse from Bascom Surgery Center, Los Gatos. She has experience in the ICU field for 23 years and has continued to be in the front lines throughout the pandemic. Today, she'll be sharing current-day hospitals and how they operate with COVID. Now, I'd love to start off with asking about your surgery center's protocols since the pandemic. Any major changes that didn't occur before COVID?
We always have to wear masks now, where before nobody wore masks.
Yeah.
So all of our patients have to wear masks when they come in.
And all the staff as well?
Well, yeah, we'll never go back to not wearing masks, because evidence showed that the flu virus alone did not circulate nearly at all in 2020. And that's purely because I think people were wearing masks and washing their hands. Another thing that I think changed was that a lot of our, definitely a lot of our clinic and patient care has been directed towards not having everything done at the hospital. Mm-hmm. So if a procedure can be done outside of the hospital, they do try to do that as much as possible now. So more surgery centers are popping up. More office-based labs are popping up, where people can have daytime surgeries, so they don't have to have it in the hospital. Also, telehealth visits. If patients can see a doctor, the first visit with a doctor, if they can see them over Zoom, patient doesn't have to go out in the rain or drive all the way there, go into the office, expose everyone to if they're really sick, and then the doctor can triage where they would have to go next without having to have them come in. We never had that before because insurance wouldn't pay for a patient to see a doctor unless they actually physically saw them. And now since COVID, that's completely changed. So
oh wow, I had no idea.
We'll never go back to not having telehealth visits anymore. So I think it's made healthcare more accessible to people that can't get out as much.
So even after the pandemic ends and there's no form of quarantine anymore, you still think that'll be continued to be used?
Oh, yeah. Doctors won't go back to that, and patients won't go back to not using telehealth. It's just too convenient.
Yeah.
And it's too beneficial to the healthcare system.
Oh, wow. And then my next question was going to be, as a nurse in the field for the last 2 decades, what is it like seeing new nurses and doctors joining the medical field in the middle of a pandemic?
I feel like their attitudes are a lot different than when me and my coworkers were getting into the healthcare field. They are coming into the healthcare field trying to look at ways to do things better and not try to come in learning how things are done. Where when I got into the healthcare field, I just wanted to learn how things are done, how people always did it, and try to fit in. Where new nurses now, yes, they want to learn procedures and how things are done, but they're always thinking about, like, how can we make things better? How can I learn more research that's done on this? They're more forward thinking, definitely. Where older doctors, they don't keep up on research. It's just once you knew how to be a doctor, that was it for a lot of physicians. Where now it's like we realized with COVID, things change every day, and research changes every day.
Yeah.
And healthcare, that we learn things every day. So if you're not one of those healthcare providers, it's not, a lot of doctors and nurses left the field because they realized their old way of thinking would mean they have to jump on this wagon of learning, learning constantly. And to some of them, they weren't at the time in their life when they could do that. So they retired.
So people that are just joining the field now, do you think they'd be in the future more lenient to changes and
Yes.
relearning, even though they've had a set way of learning, they'd be more lenient to changing the way that they progress in the field versus
I think they're more
older doctors?
They're more easily able to unlearn stuff and learn newer ways. Where older doctors, say older than 50 years old, they're less likely to be able to quickly unlearn something that they've known for a long time.
Yeah.
And relearn something if research shows it. Because they have a lot of ego. Well, this is how we've always done it. And
they're very stuck in their way.
Yeah.
Yeah. And then my next question was going to be, what is one story that stands out with you in a patient since the pandemic related to COVID?
One thing that I'll never forget was how the CEO of a hospital that I was working at was trying to make a healthcare decision about an ICU patient and whether he lived or died. So he didn't have any healthcare license or training. And because we didn't have a precedence of something happening during COVID, a patient that needed care at another hospital, and we were going to do something in the hospital before we could transfer him to save his life. And because it wasn't something that we've ever done before, he didn't want it done. And even though the doctors at this other hospital had come to do it, and these doctors that were in the ICU with many years of experience told him that it was the only option and this 21-year-old boy was going to die, he basically stood there and told us all it was too high of a risk for the hospital. And I almost lost faith in humanity until...
I'm presuming he was an older guy, too.
No, he was younger than me. He was probably in his 30s.
He was younger than you, wow.
And he was a business guy. He was purely there...
So he's not in the same field that you are at all. He's more into business than the actual patients.
Yeah. He was an MBA CEO, and he wanted to turn the hospital's financial status around before they went bankrupt. So he was willing to put lives on the line in order to mitigate a risk of us being sued. And the doctors told him, we're not doing what you're telling us. You can sue us or you can fire us, but we're saving this boy's life. And it turned out that the boy was transferred to another hospital. They got this procedure done that he didn't want done in our hospital before we transferred him, and he lived. And he didn't have any deficits. The mom came and a couple times and thanked us. And that's when I realized hospitals are not there to help patients. They're there to make money. There's only a few that are nonprofit. Their foundations are corrupt and they don't treat their employees right. So it made me want to seek out the physician that I'm working with now, who financial stuff is not his drive. He's put his whole retirement, every savings, everything that he's had to put into providing a service for people that need it.
So since COVID, you no longer work at a hospital, you work with...
Yeah, I stopped working part-time at the hospitals last year, and I have just full-time work for this doctor who shares the same vision that I do for patient care, that it can be cost-effective and efficient, and the best outcomes for the patient.
Yeah, and that's what you care most about as a nurse, is the patient over money and business.
Yeah, it has to be patient safety, and patient care has to come first.
Yeah, and that's something you've realized over the course of the pandemic more and more.
Something I've realized over the course of that pandemic is that more people in healthcare than I thought are not in this for patient care. They're in this for their own financial gain.
Yeah.
And that was disheartening. And I think that's what is disheartening to a lot of people. That you can clearly see the nurses and doctors that are in this because they want to help patients, and then there's the others that are just trying to make a good paycheck.
Well, thank you for talking with me, and I'm glad I got a new perspective on what it's like to be a nurse since COVID. I'm sure it's been a huge adjustment. So, yeah, thank you for having me. Again, this is Asia Anderson, and today we were speaking with Amy Rodriguez, a licensed nurse from Bascom Surgery Center, Los Gatos.